feel like my story, I never thought I would ever in a million years have developed a glove business, gloves and running that business. But I think that it's so important for veterinarians to know that there's always, always options.
That was Dr. Laura Catena, who turned a work disaster into a business and a mission. A CDC article cites that veterinary services rank second in incidence rates for non fatal occupational injuries and illnesses. Prior research estimates 50 to 67% of licensed clinical veterinarians and 98% of veterinary technicians experience an animal related injury at some point in their careers. Dr. Catena was one of those veterinarians, and she's working to improve those odds with some innovation. Here is her vet life story. So, one of the questions I always start with is, when did you know you wanted to be a veterinarian?
That's a really good question. My story, it is a little bit unique. So when I was in college, I was always pre-med, and I never I never thought of being a veterinarian. So everyone in my family was like in human medicine. And so it actually, my senior year of college, I was working on my pre-med degree, and I was thinking, well, I don't really want to be a human doctor. And I just wasn't sure what I was going to do with the degree. And so it actually wasn't until that year that I was like, I really want to work hard and apply to vet school. I took additional courses that were required, got the animal experience. So this was all that summer after I graduated from college. And that's when I applied. I actually had to take a year off to get all of the courses and the large and small animal experience, but then I had applied to vet school. So it was kind of after pretty much I had finished my degree for pre-med, and I was biology, but then knew that I wanted to apply to vet school.
Was there a person or what kind of sparked the interest in
Yeah.
veterinary medicine?
So that's funny you asked, because like I said, I never thought about it. And my boyfriend in college, so he applied to Ohio State, and that's where I went. And he wasn't accepted. And I knew that it was a very competitive program, and I thought that he would be such an amazing vet because his whole life he wanted to be a veterinarian.
Oh,
And so he actually went into teaching, and he loves it. And I think, he is so good at that as well. But it sparked from him because I knew the courses he was taking, the animal experience that he got. And it just wasn't until my senior year that I was thinking, I don't really want to do what I've been on the path to do. And then I don't think if I had not known him, I don't think the thought would have come into my head to apply to vet school. But I did, and it worked out, so I'm grateful for that. But yeah, just, with him, his whole life, he wanted to be a vet. So it's just interesting how like change like that, and you kind of never know, like you can't really plan everything. But I mean, he's a fantastic teacher, and I'm so grateful that it worked out for me in that regard with vet school. Yeah.
isn't it neat the different people who come into our lives
I
and
know. I know, it is. It's amazing. Yeah.
so you kind of learned late that you're interested in veterinary medicine.
Yes.
So getting into the Ohio State for vet school, um, did you have an idea of what your career might look like? What did you envision?
That's a good question. So, yeah, I was so grateful to get accepted into the Ohio State
I said it
University.
right. I said it
You did.
right.
I know, it's so funny. And I love vet school. I made some awesome friends there. I love my professors, everything. So it was a really good program. But I think that in my mind, I always thought, well, and I did the large animal rotations and the small animal course, and I just always um just really wanted to do small animal, like companion medicine. Didn't really have a big interest for like large animal medicine. So I just figured, that honestly, I thought maybe one day I'd own my own practice, or, be an associate veterinarian full time, things like that. And so my career kind of took like this fast change. But yeah, all throughout vet school, I thought it would be like a full time veterinary position for me, like so many other vets that I knew. And I never thought that it would be anything different from that, really.
Yeah.
Yeah.
And we'll get to your diverse career right and shortly. So what happened right as you were graduating vet school? How was that transition from student to veterinarian?
It was honestly, it was difficult because in vet school, I remember we did learn about the importance of having a mentor. And, as a new grad, there's so many things that you really truly have to learn. We're always learning, always educating ourselves. And so, my very first job out of vet school, it was a challenge, to be honest. I mean, I was inexperienced. I had so many questions, so many, questions about cases, or if something wasn't black and white, just, and I did not have the mentoring that that we talk so much about in school. And so it was really difficult. Um, my friends from vet school, I relied on them, and they would call me and text and things, and we would go back and forth with cases or just questions, things that we had forgotten or we needed to, revisit. But I really felt like my friends were very helpful, starting my first job. But it was unfortunate in a way, because I think that in my mind I thought, okay, I'm going to start this new job, almost that there would be somebody like by my side and for every patient, for every case. And it wasn't like that. And so it was kind of it was a surprise for me. It was a challenge for sure. Yeah,
Yeah.
absolutely.
And we talk about that. It's something I even worry about today,
Yeah,
where we have a generation of veterinarians that are coming who weren't able to bond with their veterinary classes like we most of us
right.
did.
Right.
So ha- forming those
Yeah.
relationships in vet school, I think, is really important
I
and
agree. It
throughout
was a
life.
huge benefit for me. And I agree with you. I think now, if people are more isolated, I think that I can't even imagine how I would have gotten through that first year if I didn't have that colleague support, at work, if I didn't have the mentoring, or, another veterinarian there supporting me. I think it would be very, very difficult to handle those cases. And just I mean, the support, I feel like, is so crucial, especially for veterinarians. So I agree with you. It's a concern for sure.
Yeah. So did
Yeah.
you start as general practice? Is that the setting?
So my first job out of school, I was emergency medicine, and I mean, it was busy, fast paced. We were definitely understaffed, and so it was already, I was honestly, some days it was very, very difficult to keep up. A lot of times, running behind and apologizing that you're late, or a client would be upset, and it was hard to handle those cases. As a new grad and working in emergency medicine, it was, yeah, definitely challenging. I mean, I remember that, I'd have my phone on me, and again, with my friends, it was kind of like sending them a message, and they were so helpful. And I really love that, because a lot of those shifts I was actually working by myself. And so whatever came through the door, it was like that was my responsibility to see and help. And it was very difficult. In vet school, I never ever imagined, it was going to be that way. And I'm glad that I was able to kind of navigate it with the resources I had, but still looking back, it was very challenging for sure. Yeah.
Yeah. And I know part of your story, just from reading a little bit about you, is a pretty traumatic injury.
Yes.
And it sounded like it was on the job. Do you mind sharing a little bit about that?
Sure.
Yeah.
Yeah, absolutely. So it was while I was working emergency medicine, and I was there alone. And so a cat with an unknown history came in, and it was a little bit of a confusing case, and challenging, because the owners, incredible owners, they were deaf. I was writing my questions, trying to get it, a really good history. The cat presented for an adverse reaction to flea medication. But as I was, getting more information and history from the owners, I realized that the flea medication was applied, months ago, and the
Mm.
cat was drooling and was having these signs of neurotoxicity. And this cat previously had been a stray, and so the history was a little bit convoluted. And I finished my exam, but as I grabbed my pen and my chart to start writing more notes, and the cat latched on to my left hand thumb. And so as I was like finishing up, all of this was going through my head, like, this cat had, not been vaccinated, unknown history, indoor, outdoor. The flea medication was applied, months ago. And so my concern, of course, was, did this cat have rabies, and I'd just been bitten. And so it was a lot. What ended up happening, I reached out to the head vet of the practice and I explained, I had just been injured, and what I did at work immediately, I was washing my hand. It was such a painful injury, but I knew that I needed to go to the hospital. I knew I needed to be seen, and I think in that moment, looking back, as a new grad and being so lacking the self confidence, oh, what should I do? Can I really put myself first? Can I leave work for this? I didn't leave immediately, and so I waited. The other vet came in, but there was a conflict. She really didn't want me, to leave. And I was told I'm the only vet there and she wasn't going to cover the shift and things. So it wasn't until after my shift and I went to the emergency room, and the physician there, he soaked my hand and discharged me with oral antibiotics. And so I went home thinking that, in practice, we get bit and scratched all the time. And usually, it happens and we're fine. So I started the oral antibiotics. And the next morning I woke up and the infection had spread from my left thumb all the way up the left side of my neck. My hand was 3 times the size of my right. It was swollen, painful, couldn't move any of my fingers on my left hand. And so this infection was just overtaking my body. And I called into work and I said, I even then I remember feeling some guilt and shame. It's like, oh, I can't come in today. And you feel so terrible because, and I did, and I called and they were not happy about it. But I said, I have to go to the hospital. I mean, it was that severe. I remember the location that I was working at saying, well, if we have somebody restrained for you, can you come in? And I explained, I said, I cannot use my left hand. Like I was really concerned at that point. And I went to the hospital and they had to do emergency surgery. All of my joints were septic. My blood counts were like out of the roof. It was a really serious condition. And so I was in the hospital over a week they placed a PICC line in my right arm. I had continuous IV therapy. I mean, I was in so much pain. And then after, the bandages came off, I had 7 months of physical therapy just to regain the use of my left hand. So when I was in the hospital, they didn't even know if I would be able to practice veterinary medicine again. I've recovered from it. I'm, able to use my hand, but I do have early onset arthritis in that left thumb, and my health has never been the same. So I'm considered actually immunocompromised. My white blood cell count is very low. I had so much time in the hospital, and I thought, well, why wasn't I wearing gloves? And the only gloves we had were always these bulky welder gloves,
Mm.
and I would not wear them because I felt like when you would put them on, you couldn't restrain properly or safely. The pet would become very stressed, get through your hands, then hide under a chair, and that, increased the stress of the pet, the owner. And so I felt like the gloves were just not helpful. But in the hospital, I decided if I were able to go back into veterinary medicine, what I wanted was a glove that would be very flexible, offer superior dexterity, machine washable, something that we could spray pheromone products on, use for low stress handling, and fear-free practices. It was important to me to have a vegan product as well. And so it took quite a few years, but all because of the injury, that's how I developed, the armor hand gloves, and just to really help other people who are either immunocompromised or have a pet with an unknown history, or if they've been bit or scratched before, a lot of times when we're protected, our anxiety decreases. And then as a result, the pets are more comfortable, the client as well. So I really felt that there was a need for true compassionate animal handling gloves in practice.
Wow. So
Yeah.
it sounds like you were able to go back to practice.
Yes, I eventually did. It was almost a full year after the injury, and a lot had changed. I did go back to even the emergency job, but I did not stay there long. I felt like even when I was in the hospital, they were calling, like, upset that I couldn't come into work. And when I did finally come back to work, it was like, wow, I can't believe a tiny cat, caused so much damage. And so that was the first job for me that I really realized that I kind of set standards for myself. So any job that I was going to take in the future, I wanted to make sure that they truly did care about, a work-life balance. Emergency situations come up and that they were compassionate and empathetic that things happen in life and you are at times going to have to miss a day of work, and whether it's for a severe injury like that or a mental health day or whatever, I think that practices really do need to be supportive of that. And so it was up to me to be proactive about my health, my needs. And if there was a job that wasn't supportive or encouraging of that, I would not work there. It wasn't a good fit for me. So I'm grateful I had that experience because I think I learned really what I needed in a future job. And so I'm grateful for it, but it really did open my eyes that not every practice is meant for me, really. So
Yeah.
yeah,
Or
yeah.
anyone that
Or anybody. Yes, I
that's
agree.
that
Yeah,
should be a standard. So I mean,
yeah.
have you gotten young grads that have spoken about maybe similar situations?
So I did a Zoom call with Ohio State about 2 months ago. And what we're trying to do right now is really reach out to vet schools and educate them on, safety is so important. You can still handle compassionately. And a lot of fear-free vet schools or practices are, and they're implementing fear-free medicine. The gloves are a fear-free preferred product. And so we are trying to really reach out to new graduates or fourth year veterinary students to make them aware of the seriousness of injuries. There was a vet actually I met recently. It wasn't on the job. She was walking her dog, and another dog broke the invisible fence and attacked her dog. And as she was trying to pick up her dog, she got bit on her wrist. And because of that injury, she cannot practice because any pressure on the nerve in her wrist, she faints. She loses consciousness.
Oh,
And
wow.
so she went back to work after the injury, and even wearing surgery gloves, she cannot practice. So I feel like it's important. It's really important to be aware of the seriousness of injury, of animal related injury, where it's not only painful, but it's also, extremely expensive. It's traumatic. I mean, it can really change the trajectory of your health when we get these bites and scratches. And so I think for me, a big part of Armor Hand is just educating people about that, and also along with that being proactive about your mental health, your self-care. I think it all goes hand in hand just with increasing safety at work. um,
Yeah, absolutely. And we, as veterinarians, we spend so much time, money, sweat, blood, and tears to
yes,
become veterinarians. And
yes,
when something like that happens, where your whole idea of what your life is going to be like
right.
completely changes, that is extremely traumatic. Not only are you going through an injury or a health concern,
Hmm.
but also, what my concern is that's an attack on our identity.
I agree.
What we've thought about who we were and what we were going to do in the world. So
Absolutely.
I like that we're having this conversation about, even though you were able to go back and practice, some of the things that you can do that can still be a huge part of what we've chosen to do going into veterinary medicine.
Sure.
There are a lot of things that we can do with that
Yes.
background. And so can you explain a little bit of the process of developing a product?
Sure, sure. So it was really cool and such a learning curve because I had no idea what I was doing. And I had so much time in the hospital. So I kind of just was brainstorming, okay, this is what the glove needs and this is how, and then when I was discharged, I had a long recovery, but once I was feeling better, I started just really researching materials, so different vegan materials. Definitely wanted something that was machine washable to decrease the risk of infectious disease between patients. Wanted the glove size so that they weren't bulky at all and everybody could get like the exact fit they needed. And so it was just a long process. What I did once I had an idea of the materials I wanted and like different sketches of the gloves, I started calling just different glove manufacturers. And a lot of people were not interested in either adding to their lineup, or the veterinary scope was so just out of their realm that they didn't feel like it would be a good fit. But I reached out to one company, and they've always been my manufacturer. I still work with them to this day, and they were just so supportive of everything. I explained my story. I said our profession really needs this product. I explained that, any animal handler could use it, like groomers, humane animal control, pet owners who are elderly and have to medicate or administer insulin injections, anybody who has a health concern or wants to feel more protected. I just explained that there's definitely a need for it, and we don't have a product like this. And so they've been tremendous. I let them know my idea of what I was looking for, the materials, provided them with the sketches. And so at that point, they started sending me prototypes, and I would try them on, take them to work, ask, get other people's opinions on them. And this went on for 3 years, just back and forth. And it was like, a little change here, here and there. And finally, we got the perfect fit function of the product. And so it was a long process, but definitely worth it. And, really I'm happy with the final product turned out.
Well, that's very exciting. And
Yeah.
having a little bit of a entrepreneurial background myself, I know
Yes.
there's so much that goes in even beyond product innovation and creation.
Right.
So like marketing
Oh,
and
I know. Yes.
so did you gather a team? What was that process like really
So,
making this come to life and getting it into the hands, pun
right.
intended, I guess,
Yeah.
of your ideal audience?
Sure. So, to be honest, like, so it was just me for a while. Like
Yeah.
and myself and my manufacturer. And then once I had the gloves, first person that I started working with was a designer. So we did like the website, and he helped the logo and different things like that. And I still work with him today. I connected with really amazing people, that believed in Armor Hand. And so it's been wonderful in that regard. But we're a very small company. We kind of have like our the factory we work with, and then I have like my website designer, and we implemented e-commerce on the website, and that was just recently, only about 2 years ago. We work with a couple distributors, but it's a very small group. About a year ago, I gained two partners with Armor Hand. So there's a veterinarian in Chicago and her business partner. And so they're minority owners now. But for a while, it had just been me like doing the sales and filling the orders and everything. And so it's a lot of work. It was definitely a full-time job. My kids will be in bed and I'm replying to customer emails and things like that. It really is a full-time job, but I think that as we continue to grow and expand, I'm hopeful that we can start to bring in more people that can just kind of help to delegate different things and make it smoother on everybody. Yeah.
Yes, and I will definitely get the website and all the information to
Oh,
put in
sure.
the description so people can
Thank
find
you.
you and get some for themselves.
Thank
Uh,
you.
yes, absolutely. So, what does your day look like now? Like, or what's kind of been your career
Sure.
evolution since all of this has happened?
Right now I do relief work, so I have not been a full-time vet since the injury. Just have been doing relief work, and that works so well for me because the convenience, they will reach out if there's a shift I can do, I can say yes. If I can't, there's no pressure. So I just love that flexibility so much, just to kind of be able to make my own schedule in that way, and it's been tremendous. Really helps me to balance doing a little bit of vet work, but also still primarily focusing on growing the business, with Armor Hand. So I think it's perfect. I don't think I'll ever be back in full-time vet medicine, unless I really could make that balance happen. But I do recall when I was a full-time vet, just feeling a lot of burnout. I don't think it is the right thing for me. So I think that I'm, yeah, much more comfortable doing, the relief work, working when I'm able, and then, continuing the business. Yeah.
Yeah. What are some things that you get to do career-wise that just really get you excited? Like, yes, this is
Do
what I'm meant to do.
Yeah, yeah. So I love so on the website we have different sections. We have like a whole wildlife page and wildlife rehabbers all over the world will submit stories and everything. But there's a section on the website for blogs. And so what I really enjoy doing is adding content for the blogs. I just think that it really helps me to get all of my thoughts out on any topic, like whether it's self-care for veterinarians or any animal caregiver, or our mental health, wellness, compassion for ourselves, anything like that. And so I really, really enjoy doing that. And now that I have the time, I love it. Like I really get excited when it's like, okay, I can do another blog this month and add it to the site and share that. And then I also, when we did meet with students at Ohio State, I also really enjoyed just presenting them that there's always options. I feel like my story, I never thought I would ever in a million years have developed a glove business, gloves and running that business. But I think that it's so important for veterinarians to know that if a job's not working for them or even something in the career, there's always options. And so I think it's really wonderful with your podcast, that you're letting people know that because I think even when I graduated, honestly, I thought, well, I have this vet degree and this is what I have to do, be a full-time vet the rest of my life. And it's just not that way. There's always options. So
Completely
yeah,
agree.
yeah,
Like we were talking about, I'm learning about more and more
yes,
opportunities that we can do with our
right.
background in veterinary medicine.
Yeah,
So, well,
yeah.
thank you so much for sharing your story.
Thank you.
You kind of already gave wonderful advice right there, but is there any other piece of advice that you would like to give the profession?
Sure. I would say, and it kind of goes along with the armor hand story, but I would really encourage people to make your wellness the priority because I do think that as caregivers, it comes very naturally to us to, and we care so much for our patients, our clients, our friends, our family, and that's wonderful. And but I think that it's a change in our profession when we really need to look and put our wellness first because if we are not well, then we are not able to provide care in the way we need for others. And that was a big change for me, but I would really encourage anybody in our profession to make that time, whether it is scheduling therapy sessions, exercising, maybe making changes, to how you eat, to really be honest and review for yourself what is working for you, what is not, serving you. And I think we have to be proactive about that. And we kind of really truly have to hold ourselves responsible for that. That's what I would really like to just make that message so clear because I do see so many vets that are burnt out and they're unhappy in work. It takes a toll on them. Our profession has such a high rate of suicide, unfortunately. And so I think any way we can really tell people, make yourself the priority. It's not selfish. You need to do that. We just really need to encourage that as much as we can. Yeah.
That is a very important
Yeah.
message. So thank you for highlighting that
Thank
one.
you.
Okay, so I cannot go without asking about this fantastic award, the Pet Age Woman of Influence
Oh,
Award.
thank you.
Yes, tell me more about that. How did
Thank
that
you.
happen?
So it was such a nice surprise. So I was nominated for the award. I received a call from Glenn. He's the editor of Pet Age, and at first I didn't think I understood him correctly. He was like, "You were, you were not only nominated, but there was a board that decided, and I got the award." And it was just such a nice. It was like a wonderful recognition. There were a group of people in that award that received it, and it was all for people who either brought like an innovation to the field, helped in the community in some way, had like some type of leadership. And so it was just really a nice honor to be recognized in that way. Yeah, it was wonderful.
Oh, well,
Yeah.
congratulations.
Thank you.
That is so huge. And
Thank you.
you really have contributed and continue to contribute
Thank
to
you.
the profession. So I am very proud and honored to be able to have you on the podcast today.
Thank you so
Yeah.
much, and thank you for everything that you're doing as well. It's making a difference for sure.
I sure hope so.
Yeah.
So thank you for that.
Thank you.
I always wrap up with a couple of like rapid fire questions.
Sure.
So, question number one is, what is something that is on your bucket list?
Oh, so that is a great question, and I started working on it this past week. So to visit Sweden, I've
Ooh,
always wanted to go to Sweden. I have a very good vet colleague in Sweden who actually distributes the gloves as well. And so we're going to go to different shelters, animal clinics there. And I just this past week started looking at flights. So I'm planning on doing that early in September. And that's been on my bucket list for years. So yeah. Yeah. Thank you.
congratulations.
I can't wait.
Oh, I bet. Sweden is
Yeah.
beautiful. I have actually been. So,
Have you? Oh,
yeah.
yeah. I mean, I feel like I know so much about it because I'm always reading, like looking at different websites and pictures. And so I'm so excited to yeah, have that experience.
Nice. Oh, fantastic. So, question
Thanks.
number two is, if you could create one law that everyone had to follow, what would your law be?
Oh my gosh, that is a good one. I would say, if I could, I would say to have that you would have to have a compassion for animals. And if I could, and I think just to educate people on that, it's so important to me. I feel like when you have compassion for animals, it really just enriches your life. And I think that it's just that kindness that we can show to them that is so worthwhile. So if I could make a law for compassion for animals, I absolutely would.
That's an amazing law. Love it. Question number three is, what is a simple joy moment for you?
That's a good question too. So I would say that when I'm with my boys and say we're tickling or laughing about something and we just kind of connect in that moment and we're everybody's so present and no one's distracted, I think that's one of the most simplest joys, but it is so profound and I just love those moments of like pure connection with them.
Oh, what a
Yeah.
good one.
Yeah.
And finally, what is something you are most proud of?
Okay. I would say that I probably my 2 boys. So I have, Hudson's my 9-year-old boy, Holden's 7, and I'm really proud of the men that they are becoming. I feel like they're so unique. They're their own, own people, but what I truly see in them that, resonates with me so much is they are so compassionate. So if it rains before school and we have worms in our driveway, they're gently picking up the worms and moving them to the grass. They just have this deep sense of caring for, animal life. And I see that all of the time in them. They're so great with our dogs, just so gentle, so loving. I'm very proud that they do have that compassion and empathy, for animals. I'm really proud about that quality in them.
We definitely need more
Yeah,
compassion and kindness in this world for
I
sure.
agree. Absolutely.
This has been the Vet Life Reimagined podcast. Whether you are listening or watching on YouTube, I hope you enjoyed this conversation. Please make sure you are subscribed to catch all these amazing people in our profession. Also, send this episode to someone you think who would appreciate it. Have a recommendation for someone who would be a good guest? Please reach out on LinkedIn, Instagram, or Facebook. There aren't that many Dr. Sprinkles. Until next time, Vet Lifers.